Welcome, everyone. We're very excited to have you here today. We have a couple of special guests that I'll introduce in a moment. But first, I just wanted to tell you that Dierberg's customers have always been very gracious and very generous when it comes to local charities or even charities of need, especially when there's suffering involved. In this past August, my good friends, Dr. Jim Coyle and his wife Cindy, contacted me and said they were part of an organization and that there was a hospital of great need where people were suffering, but yet there was a wonderful story going on behind the scenes. And they asked if I'd be willing to learn more about it. The more I learned and the more I read about it, I shared with my sister, the Dierbergs executive team, and we felt like this was definitely an organization that we wanted to help. And we also felt like that our customers would support us. So that's why we're all here today. And I'll introduce our two special guests. First, we have Cindy Coyle. Her family has been a part of the African Mission Healthcare Organization for a long time. Specifically, they've been very interested in the heart of Nuba Hospital. And then also with us today, we have Dr. Tom Catena. Dr. Tom Catena moved to the Nuba Mountains in 2008 when there was basically very little services whatsoever. And he has been responsible for building up the healthcare in that region. And it's quite staggering when you think about it that he's one of the sole surgeons serving like 1.5 million people. And so today we're going to hear from these two individuals. We have some questions for both of them, and you're going to get to hear about their story, and it's an exciting one, but also one of great need. So maybe I'll start off with Cindy first for you. How did you and Jim become involved with African Mission Healthcare?
We're always looking to help, and my husband heard about Dr. Tom, and when he made phone calls and researched, he was blown away. He said, this is an unbelievable challenge, a huge need, and there's a miracle happening. Tom is capable of just about anything. He could be a star football player, and he was. He's an engineer, he's a doctor. And he is dedicating his life to an area. And we said, this is one we're focused on. And that's about 10 years ago. And so the more we got involved, the more we wanted to contribute, to support. And, we know Tom personally now for a long time and support him any way that we can. So I'm happy to be sharing his story.
What inspires you most about the work Tom's doing in the Nuba Mountains?
It's endless. I mean, he could work 48 hours a day and it'd never be done. And as you said, people walk for days because he's the only one there. And so, when my husband knows that a hospital has new equipment, he'll ask them for the old and we send it. So the need is so great. And the people here in St. Louis are gifted and capable and so giving. It's just helping Dr. Tom is a privilege. And I think that when we knew him longer and deeper and knew the details, it totally changed the way Jim and I thought about our life. It changed our priorities to support him in supporting millions of people around. We are honored to be part of his life-changing and life-saving work.
And Tom's actually joining us live from the Nuba Mountains this morning in St. Louis, but it's evening in Sudan. Dr. Tom, maybe you could tell our St. Louis community a little bit about yourself and the area you're in.
Right. Well, thanks a lot, Greg. And gosh, Cindy, thanks so much for those very kind words. My gosh. I'm a medical doctor. I finished medical school way back in 1992. I spent 5 years in the U.S. Navy as a flight surgeon. I did my training actually in family practice, finished in 1999, and then came straight to Africa. I've been in Africa since January 2000, initially in Kenya, and now since 2008, I've been here in Sudan. When we started, we wanted to have an 80-bed local referral hospital for the region. We are now a 495-bed referral hospital for all of Sudan. We're getting patients from all over the country, from Darfur, from the capital city, and now with the fighting in the north, we're getting a lot of displaced people from all over the place. So we are one of the few functioning hospitals in a country of 40-some million people. The history of Sudan is tragic and complicated. How can I give you a thumbnail? Let's say that Sudan's been an independent country since 1956, and that's 68 years that's been independent, and for probably 59 years of that, it's been in civil war. The most recent civil war here in the mountains started in 2011, and that's continued up to now. Most recently, the north of the country, which had never seen war before, now has been engulfed in civil war since this past April. Really terribly destructive civil war. So where we are now in the mountains is now fairly calm, but all around us and the rest of Sudan is really a pretty terrible civil war. Khartoum, the capital, has been destroyed. We're getting a lot of displaced people coming down this way. So the history of Sudan is really a history of tragedy and of civil war. I think our philosophy since we started back in 2008 is no matter what's going on around us, we're going to keep pushing ahead and trying the best we can to provide care to people here, despite what the external circumstances are.
In the United States, we're so fortunate to have a great medical system. If you need care, you get care, and it's most people have insurance. And some of the statistics that I think they estimated for us that for your cost to provide an X-ray is like $10. A pediatric admission to a hospital is $70. Cost of a C-section is $240. Trauma surgery is $350. To sponsor medicine for your entire hospital for a day was $840. And I think your budget was just over $2 million for a year for your entire hospital. Maybe it's changed, but you're operating on a tiny fraction of what an American hospital would function at.
Right, it's true, Greg. I mean, it's about $2 million a year. And now that $2 million, we at the hospital, we'll see, like an outpatient clinic, we'll see 80,000 people in a year. We'll do well over 2,000 operations. We'll admit over 7,000 patients. Our outreach clinics, that budget includes our outreach clinics. The outreach program last year saw, I think it was 120,000 people. So that's all for that $2 million. It includes a immunization program. It includes an antenatal clinic. It includes a clinical school. We're training clinical officers, which are like physician assistants, and we're training midwives. So the school plus the hospital plus the outreach clinics, all that for a budget of about $2 million. And that cost you here, like is $250, about $250 for a C-section if you cost everything out. We don't charge that to the patient. The patient pays about $5 for that C-section. Or, we do a thyroidectomy, big thyroid surgery. It'll take me 3 or 4 hours to do it. The cost of that is about $300 to us. We charge the patient around $5 or $10 for that. And, we do that because people simply can't afford it. This place has been just blighted by war and poverty and problems for so many years. There's not the cash in this society to pay for it. So for now, this is the program we have to have. We've got to, we're trying to encourage the patients to pay something, to feel that they have some stake in the hospital. So it's not all just handouts, and we're trying to do that, but it's very difficult given the tremendous needs.
Well, the other aspect, which I think is very interesting, is you're trying to develop succession. When you got there, maybe tell me, in 2008, when you showed up, what was there?
Right, so we came in 2008. We were supposed to be an 80-bed referral hospital. Of our initial staff, we had 15 local Nuba. We had, I think, 10 expatriates, and they were the ones that had all the knowledge. The local Nuba staff, the one with the highest education, had finished 8th grade. So 8th grade, we didn't have a nurse. We didn't have a licensed practical nurse. We didn't have a nurse aide. They were just people that finished primary school, all right? No practical skills at all. So we had to train them in everything. We had to train them how to put a patient onto a weighing scale and weigh them. We had to train them how to plot a temperature on a graph, how to do an injection, how to start an IV line, how to assist me in the operating room. Everything from zero had to be done by myself and these expatriates. Now, if you fast forward, it'll be 16 years next month. We've sent a few people to medical school. We've sent several to be physician assistants. We've sent, I think, 80 total people for nurses, lab technicians, pharmacists, an entire staff we sent out for training. We still have a lot of on-the-job trained staff, but all the key positions now are staffed by local Nuba that have the proper qualifications. So we've come, a long way from, 8th grade education to now we have medical doctors and, we have registered nurse anesthetists, we have lab technicians, the whole ball of wax we have.
What else would you want our customers to hear and the people of St. Louis to hear about your hospital?
Well, I think a couple things. 2 things mainly. One is the need here is tremendous. There's kind of one other small hospital in the region, and that's pretty much it. You've got a few clinics scattered around that don't have a steady supply of drugs. So we're the main health provider by far. We are the surgical provider for an area the size of Georgia. And now, with the Civil War in the north and the collapse of the health system in the northern part of the country, we're literally one of a handful of hospitals taking care of 40 million people. The efficiency that we can treat people, I think, is unmatched. And I'm not saying it to boast. I think that's just how it is. We can treat a lot of people at very, very low cost. I think if you're looking at how to spend. If you want to give a donation, you don't want to kind of waste your money on a lot of frivolous costs and administrative fees and everything else. I think the money is very well spent if it's sent here. We really economize every dollar we get here.
Tom, I know you're putting your life on the line. I read also where you've personally gotten sick multiple times, very, very ill, in a coma once, malaria. You've had a lot of personal struggles as well. There's one more thing I think you should share. I read something where you define joy. Do you mind just sharing the difference between happiness and joy?
Happiness is an emotion, and it comes and goes. I mean, you have ups and downs. A lot of the work here doesn't make you happy. It's extremely difficult. It's tiresome. We have a lot of patients. Some have bad outcomes. Terrible things happen. Kids get burned to death during the war. A lot of terrible things happen. You can't possibly say, "Oh, I'm so happy." You know, it's kind of silliness. You know, joy is the feeling that I feel deep down. I know I'm doing what I'm supposed to do, that I'm doing God's will, that I'm where I'm supposed to be. And I think that's where I get joy from. Joy is kind of knowing I'm on the right path, I'm doing what I'm meant to be doing. And that no matter what happens, you know, you have happy days, you have sad days, we have big ups, we have terrible downs. The joy is there because you're in the right place, you're doing what you're supposed to be doing. And no matter what's going on around you, you maintain that joy because you are in the right spot. And I think it's one of the things that's kept me here all these years and just kind of kept me going.
Thank you. So Dierbergs is going to be doing a roundup of the Register and a collection from February 27th through April the 8th.